What?
Hello, I'm going to be assessing the nose, mouth, and throat of an adult patient. First, I would begin by inspecting the external nose for symmetry and lesions. The nose is symmetrical in the midline and proportioned to other facial features. There is no sign of deformity, asymmetry, or skin lesions present. Next, I will inspect for facial symmetry, which assess cranial nerve 7, noting the symmetry of eyebrows, palpable fissures, in other words, opening of the eyelids, nasolabial folds, and the size of the mouth. There are no signs of abnormal facial structures or abnormal swelling and involuntary movements. Next, I will test the patency of each nostril by pushing each nostril wing shut with my finger, while asking the patient to sniff inward through the other nair. I will then test the other nostril, noting no signs of obstruction. Next, I will inspect the nair. Because I do not have an otoscope, I will be using a pen light for this part of the assessment. By gently lifting up the nose with my finger, I will view each nasal cavity while the patient's head is erect and when the patient's head is tilted back. The nasal mucosa should be moist, normal red color, and smooth, taking note of discharge, bleeding, or foreign body. I will then inspect the septum for signs of deviation, noting if airflow is obstructed, perforated, or bleeding. I will then inspect the turbinates, which are the bony ridges curving downward from the lateral walls. The turbinates should be light red in color, same as the nasal mucosa, taking note of any swelling or polyps. Now we will be assessing the mouth and the throat. I will begin by using my pen light to inspect the patient's mouth. I will inspect the patient's buccal mucosa, noting color, nodules, or lesions. It should look pink, smooth, and moist. In dark-skinned people, patchy hyperpigmentation is common and normal. I will observe the teeth and the gums by examining for disease, absent, loose, or abnormal position teeth. I will check to see if the teeth are white, clean, and free of debris and decay. I will then ask the patient to bite as if chewing something to observe the alignment of the upper and lower jaw, noting that the back upper teeth rest directly on the lower back teeth, and in front, the upper incisors is slightly in front of the lower incisors. I will examine the gums for pink or coral with dotted surface, noting that they are tight and well defined with no signs of gingival margins, bleeding, swelling, or discoloration. I will now check the tongue for color, moisture, and surface characteristics. The tongue should be pink and even. The dorsal surface of the tongue should be roughened from papillae, also known as the taste buds. A white coating may be present. I will then ask the patient to touch the roof of their mouth with their tongue. The ventral part of the tongue should view veins and saliva should be present. I will then present my pen light up to the roof of the patient's mouth to assess the palate. The hard palate is white with irregular transverse rugae. The soft palate is pinker, soft, smooth, and upwardly movable. I will now inspect the uvula by asking the person to say ah, noting the soft palate rise in the midline, which tests for cranial nerve 10, or also known as the vagus nerve. It normally looks like a fleshy pendant hanging in the midline. With my light, I will then check the tonsils, which should appear the same color of the oral mucosa. To check the grade of the tonsils present, 1 is considered visible, 2 is halfway between tonsillar pillars and uvula, 3 is touching the uvula, and 4 is considered touching each other. 1 and 2 are considered normal and healthy people. To test for cranial nerve 12, also known as the hypoglossal nerve, I will then ask the patient to stick out their tongue. It should protrude in the midline, noting any signs of tremor, loss of movement, or deviation to the side. If necessary, you can bimanually palpate the patient's mouth.